8:45 on your Tuesday. Between rising premiums, copays, out-of-pocket costs, many of us are struggling to afford health care. Now, we may not be able to control some or most aspects of what we pay, but there are things we can control. There are things we can do to save. So, Trae Bodge, smart shopping expert's here to share her favorite strategies. Good morning, Trae.
Good morning. Great to see you.
So, as healthcare costs continue to climb, what's one common costly mistake that we make?
Yeah, so the one thing that troubles me is that people often set it and forget it with their health insurance. So we go through our open enrollment period around November, December, and folks just let their plans roll over. And the mistake there is that you may have another plan, another option, something that's cheaper, something that has more comprehensive care. So it's really important every year to check, even if you're providing your own health care through the Healthcare Act, or if it's being provided by your employer. And then second to that is just you want to familiarize yourself with the features of your plan because they change every year. So just make sure you're staying up to date so you don't make that mistake.
Okay, those are good. Those are real good. Let's talk about the health savings accounts and flexible spending accounts. Those are usually options when you're talking about the options that you get to choose every year. How could those help people to save money?
Yeah, so the FSAs and the HSAs are often an element of a plan, and a lot of people don't use them because they're kind of mysterious. But really what it is it allows you to use pre-tax dollars for medical related expenses. So it could help with doctor's visits, it could help with prescription eyewear, or even sunscreen. So if this is available in your plan, make sure that you're utilizing this because the IRS just increased the allowable amount that you can use for your HSA or FSA. So this can be a really helpful savings tool.
All right. How about, you mentioned prescriptions. Are there other ways that we can save on prescriptions, which can sometimes be just outrageous?
They really can. I mean, some of them are so cheap, and then some of them are hundreds of dollars a month. So you really want to look around. So there are certain retailers that are known for lower cost prescriptions. Walmart happens to be one of them, Costco as well. So it may not be just going to your either the closest local pharmacy may not have the best price. So shop around there. And then also what I like to do is if there's a prescription that I'm taking regularly, I will get 90 days instead of 30 days. Your doctor is often happy to do this, and this makes it a much lower cost, and then you don't have to pick up your prescriptions as frequently, which I really like as well.
Wait a second, I've never heard of that. I didn't know you could do that. So you can tell, because it's usually because I don't know, I get a couple of prescriptions. I didn't know you can ask to make it longer.
Yes, you can ask. And, of course, if it's a controlled substance, they're not going to allow it. But if it's something for a thyroid or something very simple and, not a dangerous drug in any way, you can get 90 days. And it's so convenient and much less expensive.
I like that. Yeah, a few years ago, I started taking just an allergy pill that was prescribed, and it was great. And
right.
I'm going to ask, look at this news I can use. Thank you, Trae. All right, we got a couple more. What about where we choose to get our care?
Yeah, so this is something that a lot of people don't think about. You think if you don't feel well or if you have a checkup, you just go to the doctor. But some of these visits can be done by telehealth, and telehealth is less expensive than an in-office visit. So if you're just confirming blood work with a doctor, for example, ask if you can do it by telehealth. And then kind of conversely, if you're not feeling well, you may want to just dash off to the ER, but maybe it's something that you could get done at a clinic instead. The clinic will be less expensive than the ER. So think about telehealth and clinics whenever you can to keep that cost down.
We actually did this. We did this recently. I think it was just in this past winter, and I can't remember what one of the kids had, but we're like, oh my gosh, we had these things going on. I cannot take him right now to the urgent care or whatever to get something. And we said, you know what? Let's just try that app. And there we did. We pulled it up. The doctor appeared right there. I was like, oh yeah, he's got this. Let's get this for him. And it worked out really fast, and it was not expensive. So that's a great one. Okay, last question about preventative care. How do we save money on preventative care?
So first of all, preventative care in general is a money-saving tactic. If you're not going to the doctor once a year and getting those regular tests, something could be brewing in your body. And if you wait too long, then it becomes this other thing. So go to your primary care doctor at least once a year. Get into the habit. And especially as you get older, there are tests that you should be running, like a colonoscopy, getting your prostate checked, mammograms, things like that, that we should be doing on the early end so we can catch things before they become a problem. So make sure to commit to that preventative care every single year.
Okay, Trae Bodge, thank you for all of those good tips. Have a great day.
Thanks so much. You too.